Thank you for the opportunity to present to you at this esteemed conference. The title of my presentation is Increasing Uptake of Tuberculosis Preventive Therapy Among Adolescents and Young People Living with HIV, the Role of Peer Support. This is the outline of my presentation. Tuberculosis is a common cause of morbidity and mortality among people living with HIV. It is estimated that it is causing 1 in every 3 AIDS-related deaths. An estimated 10 million new cases of TB disease were identified globally in 2019. And among these new cases, 8.2% were people living with HIV. Approximately 1.4 million people died from TB disease. People living with HIV accounted for 15% of these TB deaths. Zimbabwe is one of the world's top 48 countries heavily burdened by TB. It is also important to note that Zimbabwe has a high burden of HIV estimated at 12.9% among adults. An estimated 29,000 new cases of TB were identified and 6,300 deaths occurred in Zimbabwe in 2019. People living with HIV are accounted for 73% of the TB deaths, highlighting the high burden of TB HIV co-infection. Adolescents and young people living with HIV face elevated risks of tuberculosis disease. This is associated with the impact of puberty on immunological changes, the broadening of social contacts as they grow, and late diagnosis, which often results in adverse health outcomes. The offering of TPT to people at highest risk of TB is recommended globally. TPT is one of the 10 priority recommendations outlined in the 2020 Progress Report on TB. However, access and uptake has remained suboptimal, including in Zimbabwe, although there are concerted efforts to improve access to TPT. Adolescents and young people living with HIV are often hesitant to start the therapy due to fear of side effects and pill burden. The Zandiri model is a peer model that supports the National HIV Program to increase availability, uptake, and quality of HIV services for children, adolescents, and young people living with HIV. At the forefront of this peer model are community adolescent treatment supporters who are HIV positive, 18 to 24 years. They are trained and mentored peer counselors. Integral to the CATS support is the TPT intervention. And with this, the CATS provide adolescent-friendly information to their peers and their caregivers to promote TB literacy and early uptake of services. The CATS also conduct TB screening in the community and TPT referral of those who are eligible to the nearest health facilities. The CATS also provide support for adherence among those who have started TPT, and they include their lived experiences during into virtual platforms have been made for screening, referral, and adherence counseling in line with the COVID-19 infection prevention and control measures as guided by Ministry of Health and Childcare. The Zandiri program has received technical and financial support from PEPFAR through USAID in 6 high HIV burden districts of Zimbabwe in Country Operating Plan 20. We descriptively analyzed program data from 6 districts to examine the effects of CATS on TPT uptake. A total of 11,200 adolescents and young people living with HIV are supported in the Zandiri program. Among these, 68% were screened for TB in the community by the CATS between October 2020 and June 2021. Approximately 35% utilized TPT since July 2018, that is in the last 3 years. It is noteworthy that 70% of those who had utilized TPT were started TPT between January and June 2021, and that's accounting for almost 3/4 of the initiations over the last 3 years. This graph is showing the quarterly trends in TPT initiations from July 2018 to June 2021, and just highlighting that the majority of the initiations occurred between January and June 2021. The remarkable progress in TPT uptake is associated in part with kids' support to their peers. It is significant to note that uptake was near universal, 91% among the kids in June 2021, and 70% of the kids had actually completed their course. These are strategically positioned the kids to share their lived experiences with their peers. Through the Randiri program, we learned that engagement of trained, mentored kids is an effective strategy for mobilizing adolescents and young people for TB services, including screening and TPT uptake. The kids as champions is also an effective strategy for dispelling myths and misconceptions and creating demand for TB services. Information sharing about TPT and TB presented in a child and adolescent-friendly manner is an effective way of sensitizing adolescents and creating a demand for TB preventive services. In conclusion, trained mentored kids are an effective strategy for mobilizing adolescents and young people for TB services, as well as promoting self-care. Peer models such as the kids should be prioritized for TB screening and supported with TPT as their experiences can be utilized effectively for TB preventive services in an adolescent-friendly manner, which stimulates uptake of these available services. The Randiri program gratefully acknowledges the support from PEPFAR through USAID, the Ministry of Health and Childcare, the children, adolescents, and young people living with HIV, and their families and communities we support. With support, we stand strong. Thank you.